It used to be considered a very rare disorder, and patients and physicians didn't know a lot about it for many years. But as the awareness has grown and education has grown, it has become very well understood and has led to the development of wonderful drugs that are really changing the landscape for myasthenia.
I do try to raise awareness. I think even among my own friend group, my friends are very educated on myasthenia. They're very educated on the things that I need and the things that would make me better. Personally, I work a lot with the MGFA, the National Organization for Myasthenia, and working with teens and spreading awareness for the teens group of people with myasthenia, just because the illness isn't very present in people under, I believe, 40. So we don't get a lot of the resources. We don't get a lot of the time from people. So I am working with them in expanding their search for teens to talk to and look at, and making the subject so more open so that it's not taboo anymore. No one's afraid or scared to address it in people under 18. Because I know for me, I was 12 when I first started experiencing symptoms, and I think if I had someone, even a couple of years older than me, to kind of walk me through the process, things would have gone a lot smoother.
So the MGFA is a wonderful organization. Advocacy in general is extremely important. The greater awareness there is leads to more education. The more education leads to more drug innovation, and drug innovation leads to cure of disease. So the MGFA really works for both development of research, development of patient education, awareness, the development of support groups throughout the country is phenomenal. There's a new support group that just opened up in New Jersey, which is wonderful. You can also develop huge social networks for patients. The emotional aspects of the disease can be very overwhelming, especially the patients who have refractory disease. You should never underestimate the emotional aspects of the disease, and those can weigh on patients just as much as the physical aspects. And the social network that you can develop through advocacy and through these organizations can help change the patient's experience with the disease and their recovery.
I was first, I think we first met the MGFA through my doctor. He was like, this is someone you should reach out to. You know, they have a focus group, and they have people you can call if you have questions and information and things like that. And when I had reached out to them, they were like, you know, we have this tri-state walk every year. And my mom and I went just to look the first time and see, and I think that was one of the best feelings I had ever had. Because even though everyone there was older than me, it was just this big crowd of people who knew exactly what I was going through. They knew exactly what all of this felt like.